Good morning, everybody. Happy Friday. It's sunny outside. Thanks for joining us right before lunchtime. My name is Jake Doman. I lead the consulting, new business, and marketing team at Axion RMS. At Axion, we are employee benefit consultants, risk managers, and insurance brokers. As an organization, we focus on middle market organizations by creating multi-year strategic plans that bend healthcare trend flat, keep organizations compliant, and foster consumerism to improve health for all the employees. I'm really excited today to talk about a couple extremely pertinent topics that have recently come out. We got Wes Covert from Later Mutual to help us along the way. Wes is a true expert in everything that is employee benefits, ERISA, and I don't really want to steal his thunder, so I'm going to let him continue introducing himself and get right into the presentation. Wes, thanks so much for joining us.
Thanks for having me, Jake. So thank you for the opportunity to discuss a few of these legal issues that are going to impact your health plan in 2021. My name's Wes Covert. I'm a partner at the law firm of Later Mutual, and we represent and counsel employers in all sorts of various aspects of employment, labor, and employee benefit matters. I've been practicing in employee benefits for about 13 years now and spend a significant portion of my practice in health plan compliance. So without further ado, let's go ahead and dive into today's webinar. Next slide. So our agenda for today, we have four main topics. We're going to talk first about the Cobra subsidy, which is on top of everyone's mind at this point, and then the upcoming price transparency disclosures. There's some significant disclosure requirements that plans will be facing in 2022 and 2023, so we'll touch on that. We'll also discuss mental health parity compliance updates. There are current obligations that health plans must meet, and we want to make sure that you're aware of those. And then also some optional cafeteria plan design updates that came down earlier this year that you may want to consider as well. All right, so let's start with the Cobra subsidy update. So this is probably what everyone has been dealing with over the last few weeks. The Cobra subsidy was enacted by the American Rescue Plan Act of 2021 back in early March. And this is a means by which the federal government subsidizes 100% of the cost of Cobra premium for someone for 6 months, April 1st through September 30th. But it only applies to certain qualifying events. And it only applies to someone who was involuntarily terminated or had a reduction in hours. And we'll flesh that out a little bit later. It applies to health plans that are subject to Cobra, so group medical, dental, and vision plans, but not health flexible spending account plans. It also applies to governmental employers, and it applies to state mini Cobra, which is a little different just from the standpoint that those plans are not subject to Cobra. However, those individuals who would be eligible for state mini Cobra could be able to get subsidies for that coverage. The subsidy ends on the earlier of September 30th, 2021, or if someone becomes eligible for other coverage during the 6-month subsidy period, or if someone's original 18-month Cobra period ends. So those are the three benchmarks at which point someone's coverage would terminate. We have a poll question, so feel free to submit an answer regarding how you believe that the Cobra subsidy will impact your organization. So after that overview, let's get into the weeds a little bit on some of the key points of the subsidy. All right, let's talk about eligibility. So someone will be eligible for Cobra subsidies if they experienced a qualifying event of either an involuntary termination of employment or a reduction of hours, and their original 18-month Cobra period would include any month between April 1, 2021 through September 30th, 2021. So what does that mean? That means, oh, we got the results. The results are in. So how do you foresee the Cobra subsidy affecting your organization? It looks like we have a tie for first. 33% say it's going to increase Cobra cost. 33% say they have a hard time, difficulty understanding the new legislation. So hopefully you have a little bit better understanding after this webinar. And 22% they are trying to plan for the future, and then 11% are having difficulty explaining new legislation to the executive team. So thank you for sharing that information. So the eligibility, what this means is that someone could be involuntarily terminated all the way back in October of 2019. That's right, 2019, and whose Cobra coverage would begin November 1 of 2019, and they would be eligible for subsidies potentially, since the last month of their 18-month Cobra period would include April of 2021. So remember, if anyone was involuntarily terminated, had a reduction of hours, and that caused them to be eligible for Cobra, and their 18-month period includes any month between April 1 of 21 through September 30th, 21, then that is going to put them in a position to be able to get subsidies. Of course, if they have other coverage available, then that would disqualify them. So the individuals that we're looking at are the folks that are eligible for coverage currently during that period of time, and then anyone who potentially would have been eligible but maybe dropped it or never elected, but had they elected, they would have been eligible. Those also are individuals who would be eligible for the subsidy. As well, we can't forget the dependents. This includes any dependents who are covered by the health plan the day prior to the involuntary termination or reduction of hours. So let's dig into what does it mean to have an involuntary termination of employment and a reduction of hours. All right, so involuntary termination. This has kind of been one of the key questions as it relates to the guidance that we've received to date. Each person's circumstance is going to be different, but so we really have to examine the facts and circumstances of each situation. But the key and common element that is going to really drive whether the termination was involuntary is whether the employer took a unilateral action that caused or initiated the employee's termination. Was the result of the termination due to the employer's action, or was it largely because the employee voluntarily resigned or retired? That's going to be a key indicator. But again, it's a very facts and circumstances heavy situation. Let's go through a couple of examples. So termination for cause. Obviously, if someone violates a policy and they were terminated, that would be an involuntary termination. Not renewing an employment contract when someone was willing to continue work. That would be an involuntary termination because the employer is unilaterally taking a step to end the employment relationship. An employee's retirement. If absent the retirement, the employee would have been terminated soon thereafter, or the termination was just pending and it was going to happen regardless, then that would be viewed as an involuntary termination. So again, each case is different. You have to look at each situation. And so definitely recommend having a legal counsel consult during that period of time to make sure that you're capturing all of the right individuals as you're sending out the notices that we'll be talking about. A little helpful piece of information was that back in 2009 during the recession, there was a similar Cobra subsidy, and guidance was issued by the IRS then that does provide further examples about what an involuntary termination could include. Surprisingly, we haven't received that guidance yet for this subsidy from the IRS, but we do expect it really any day now, to be honest with you. So we'll keep our eyes peeled for that. All right, so let's take a look at what a reduction in hours looks like. So a reduction in hours, unlike a termination, is any reduction in hours, whether it's voluntary or involuntary. So that doesn't even come into play. So all we look at is just whether there was a reduction in hours that caused a loss of coverage that made someone eligible for Cobra. So a few examples that the Department of Labor provided was reduction of hours due to a change in business operation, going from full-time to part-time, going on a temporary leave of status. Furloughs are another example, participating in a lawful labor strike. Those are all examples that the Department of Labor has provided. Let's keep moving and let's talk about the notice obligations. So obviously, to inform the individuals about the subsidy, employers have an obligation to inform them of the subsidy. Fortunately, the Department of Labor has provided model notices to assist with that task. Let's walk through some of these notices. The DOL's website, they actually have quite a bit of information, so have some helpful FAQs, the model notices, and other information. The first model notice is basically a model general and election notice. Those are two standard Cobra notices that you probably are already providing. A general notice is when you provide a general notice of Cobra obligations within the first 90 days of enrollment. An election notice is provided at the time that someone is eligible for Cobra. And so this notice would replace what your current notices are, because it includes language about the subsidies. And this would be something that you would use for anyone who has a qualifying event between April and September of this year. The next notice is the notice that's available for all those folks that had a qualifying event prior to April 1, 2021. Those folks who might have dropped Cobra early or never elected it. And so we're trying to reach out to those individuals, and those are the individuals that would have been on Cobra because of that involuntary termination or a reduction in hours. And that notice must be provided by May 31st of 2021. That's your deadline to get that notice out to all those folks that previously either waived or dropped or never elected Cobra that could be eligible at least for a month of subsidies between April and September. The summary of Cobra premium assistance provisions. This is just information about the subsidies, and this is something that's supposed to be included in both the model election notice as well as the extended election period notice that I just discussed. And then also there is an obligation to inform individuals of when their subsidy expires. Now, importantly, you do not have to do this if someone's subsidy ends because they have other coverage available to them. And importantly, their subsidy is that they become ineligible for the subsidy if they are only eligible for other coverage. That's important because Cobra usually you become ineligible for Cobra when you enroll in other coverage. Here, the subsidy ends if you become ineligible for other coverage. So that is a key distinguishing factor. So, but in any other circumstance, for example, someone's 18-month period is about to expire, you need to provide them a notice between at least 15 days before that expiration, no later than 45 days, letting them know that their subsidies are going to expire, at which point they would have an opportunity to plan for the future. It might be enrolling in a marketplace coverage option. So, and then finally, there is a notice specifically for state mini Cobra, so that the DOL did provide an alternative notice for those folks who are subject to state mini Cobra rules. And then, as usual, the best way of getting these notices out to folks is first-class mail to their last known address. So let's keep moving forward. And so let's talk about who gets the subsidy. All right, so individuals, they have to apply. So the subsidy isn't automatic. Individuals must apply for the subsidy by sending in their application within 60 days of receiving the notice. The 60-day deadline is not impacted by that deadline extension that occurred last summer, when the deadlines for paying for Cobra, electing Cobra were all extended due to the pandemic. That is a wholly separate issue. This is a hard 60-day deadline. If they don't get their election within that 60-day period, they will not be eligible for subsidies. Okay. So as part of that election process, the individual must inform the employer if they have other employer coverage or if they're eligible for Medicare. And so if they have that other coverage, that would make them ineligible for the subsidies. So also for those folks who either never enrolled in Cobra or who enrolled but later dropped it and who are now getting that second election opportunity, they can elect Cobra and finish out their original 18-month period and receive subsidies beginning April through September. So for those folks, they don't get coverage going back to the time they dropped it or going back to the beginning of the 18-month period. Their coverage would begin April 1st and then go forward from there. So in terms of the getting the subsidies, If you administer a multi-employer plan, the plan would be receiving it. Employers will generally receive the subsidy, as we'll talk about, through a payroll tax reduction. And then single employers that are subject to the state mini Cobra laws at this time, based on the guidance received, the insurance company would be receiving that subsidy instead of the employers. That might change based on future guidance, but that's where we're at the moment. Right. So how do we get the subsidy? For individuals, it's pretty simple. They just simply don't pay their premiums between April and September. If they've already made a premium for April at this point, they should be making arrangements with the employer in order to get a refund. And then we are still waiting on guidance from the IRS about the specific forms that are needed in order for employers to be able to claim the credit on their payroll taxes. This credit, which will account for the amount of the subsidy, is both refundable and advanceable. So the employee doesn't pay, and then when the employer pays their premium, they will then take that amount that they're paying for that premium and take a credit on their payroll taxes for that same amount. More guidance is expected from the IRS on the specifics, so keep your eyes peeled for that. All right, so let's take a look at some practical considerations that we have with regard to the Cobra subsidy. One of the things that another aspect of this is that employers can offer an optional plan enrollment opportunity to the folks who are eligible for subsidies to allow them to choose between all the different plans that the employer may have for their regular active employees. And if they do that, then they have to make that election within 90 days of receiving the notice about the subsidy. But keep in mind that if you do that, then a subsidy eligible individual will only be able to choose the plans that were immediately available prior to their involuntary termination or reduction of hours. Otherwise, that's usually the case if you don't choose this option. So whatever they had right before they went on to Cobra is generally what their options are going to be. Otherwise, the employer has the option to open up all the different plans and make them available to the employee. However, that might open up some additional administrative burdens. There's additional notice obligations for the employer, and you also have to make sure that you meet certain requirements, including that you got to make sure that the premiums that are charged for those other plans are the same or lower than the coverage that's offered to the individual at the time of the qualifying event. So a couple more hurdles to jump through if you decide to offer more options to those folks who are eligible for the subsidy. Additional things to keep in mind, let's recommend coordinating the notice distribution efforts between the Cobra administrator and the payroll vendor, because the payroll vendor will be mindful of taking any sort of credits for payroll tax purposes, and the Cobra administrator needs to make sure that they receive an accurate list of individuals to send these notices out to. To that point, you need to make sure that you're correctly identifying all the individuals who were involuntarily terminated or had a reduction in hours going all the way back to October 2019, just to make sure that everyone's captured. When determining whether someone was involuntarily terminated, consider erring on the side of eligibility and confer with legal counsel. If someone feels that they have been improperly denied a right to subsidy, they can challenge you. They can contact the Department of Labor. And so that is something that you could be presented with. And so you need to make sure that you're carefully considering who is eligible for these subsidies. Also consider the impact on any severance or separation agreements that you already have in place. You might already be subsidized in Cobra in various situations. You may need to take a look at those agreements or revise those agreements in order to account for the subsidy. And then also, we mentioned this earlier, be mindful of the fact that we already have extended deadlines to elect Cobra under normal circumstances based on that extension guidance that came down last year related to the pandemic. So folks already are under a period where their ability to elect and pay for Cobra is extended. But just remember, if they do not elect the subsidies within the 60-day period following receipt of the notice, that's a hard deadline. So they would essentially be waiving that right if they don't return their application for subsidies within that 60-day period. All right, that's a lot of information there. So let's go on to even more information. Our next topic is something that could very well have the most significant impact to health plans since the Affordable Care Act. And after the Cobra subsidies, you're probably thinking, wow, what are we getting into now? Well, I feel like that we're kind of just at the beginning of these changes and the requirements. There were two main sources of transparency disclosure requirements that have come down over the past couple of years. The first was a 2019 executive order by President Trump that led to final rules being issued in October of last year. And the purpose of those rules was to have greater transparency from health plans and insurers regarding the cost of the coverage and treatment and services that you receive in order to be able to understand those costs, maybe negotiate those costs or find better pricing between plans or healthcare providers. These rules apply to non-grandfathered health plans. So if you have a grandfathered plan, that does not apply to you. And then the other main transparency disclosure, source of transparency disclosures was the No Surprises Act that was part of the Consolidated Appropriations Bill that was signed at the end of last year. And the No Surprises Act imposes additional reporting and disclosure requirements from health plans and insurers, as well as limiting surprise billing from out-of-network services and emergency services. And it also requires certain disclosures from brokers and consultants. So with that in mind, let's go ahead and jump right into the disclosures required from that 2019 executive order. So there were two main disclosure requirements that came from that order. The first one is the cost sharing information from a health plan that is supposed to be disclosed to plan participants. And the other is something that's made available to the public, and it pertains to the rates that are the rate information that's being disclosed. So beginning in 2023, plan sponsors will be required to provide the cost sharing and rate information at no cost to the participant through a self-service tool on a public website that provides real-time responses based on cost-sharing information that's accurate at the time of the request. If requested by a participant, the information must be mailed in paper form within 2 business days. So if someone wants a hard copy, they're entitled to that hard copy. And so some of the information that's provided is in 2023 is a list of about 500 different shoppable services. And you're wondering, what's a shoppable service? Well, basically, it's anything that a participant could be able to schedule in advance. So that might be a service at an outpatient clinic, an MRI, or lab work being done. So the idea here is to be able to allow someone who's a participant in a plan to be able to budget and understand the costs that they're facing as they move forward with scheduling services, and then potentially be able to pick providers that might be able to provide more affordable options. Moving on to the next slide, the second disclosure that came from the order was a public disclosure. And this was pertaining to a disclosure that a plan must, free of charge, disclose the negotiated rates for in-network providers, including whether any alternative payment arrangement exists, and as well as the historical allowed amounts for out-of-network providers and prices for prescription drugs. This is a lot of information, and this is also something that has received some pushback. But this, again, will allow folks to be able to understand what they're paying for their services and be able to maybe shop for services that are more affordable. This information must be in a machine readable and readily accessible format. And so as you can see, with all of these requirements, health insurers and plan administrators have a lot to consider, because this requirement, the public disclosure requirement, begins in 2022. Let's move into the next slide. So let's talk about some of the things that folks are doing to plan for this. Allocating responsibility. So insurers are going to be the primary entity responsible for insured plans, whereas plan sponsors are going to be responsible for self-insured plans, although you may be able to allocate the responsibility via written agreement. Excluded plans, as we talked about, grandfathered plans, accepted benefits that do not apply here, so we're looking at non-grandfathered group health plans. If the health plan fails to provide this information, there's a $100 per person per day penalty that's attached. So it's very important to start now with a compliance plan, to talk with your broker, your consultant, your insurance provider, to be able to make sure that everyone is on the same page as you're plotting out how this is going to be executed in the future, so that you're timely in compliance. The second piece of disclosures that we're going to be talking about comes from the No Surprises Act, and we'll try to buzz through some of these different requirements. This legislation includes actually several new requirements, and so one of the things that we are waiting for is implementing regulations and guidance. At this time, all we have is the act, so we expect later this summer to get specific guidance as it relates to how the No Surprises Act will be implemented. The first new disclosure under the No Surprises Act impacts brokers and consultants, and specifically, they will need to disclose to the plan's fiduciary any direct or indirect compensation that's at least $1,000 or more. Plan administrators will need to receive this information before entering into contracts with such consultants and brokers. And as you can imagine, this will require, at the end of the year, significant amount of amendments and changes to current agreements, as brokers and consultants will be providing those disclosures to their clients. Next slide. So with regard to price transparency requirements, so we have a service provider disclosure requirements. Beginning in January 2022, there are additional price transparency requirements that kind of augment what we just talked about in the requirements that came from the 2019 executive order. Going through some of those now. So after submission of charges by a provider, a participant is entitled to an advanced explanation of benefits that is supposed to provide additional information about the rates and charges that they'll face for the services rendered. There's also supposed to be a price comparison guidance via phone or online tool, so that folks will be able to be able to compare prices among providers based on geographic region. Insurance cards are supposed to have more information about cost sharing, as well as a telephone number and website to seek network assistance. There has to be a notice to continuing care patients when a provider's contract has been terminated. So if someone is in a situation where they're receiving ongoing care and their provider is no longer going to be treating them because their contract has expired, they have to be notified of that. And then there also has to be created a process to verify the accuracy of the database of information that's supposed to be available from providers and plans that we touched on earlier. Next slide. One of the key aspects of the No Surprises Act is to be able to limit the surprises that participants and patients receive when they receive a bill from an out-of-network provider. This is a pretty significant change. It requires that health plans must cover emergency services at non-participating facilities, services provided by non-participating providers at a participating facility, and non-participating provider air ambulance services with the same cost sharing, whether the services are provided from a participating or non-participating provider. Those are some tongue twisters in there. So the idea here is that there's no balanced billing on these emergency services that are being provided, and the health plan and the out-of-network provider will need to resolve those differences outside of the participant. The participant will just simply be billed for the stated amount from the plan, and then there would be any sort of balanced billing would be worked out with the plan, not the participant. That way, that limits that big bill, that surprise bill that some participants receive as a result of receiving emergency services. On. So looking at some next steps, similar as to what we discussed earlier, we're waiting on implementing regulations. The one difference is that the No Surprises Act applies to pretty much all group health plans, grandfathered and non-grandfathered. And so that's why it is very important for you to engage in discussions with your plan administrator, service providers, brokers, consultants, and insurance carriers about making sure that your plan is on the right track to make sure that you're going to be ready and compliant come 2022. All right, and we have another poll question. So you have a little bit of background now on the new transparency law. What do you think is going to happen with your employee benefit plans based on these new transparency laws? Go ahead and provide us your feedback, and we'll see what the poll results are in a moment. Up next is our third topic, which is mental health parity compliance. So this topic has become a very high priority for the Department of Labor during compliance audits. By way of background, the purpose of mental health parity rules is to make sure that the cost sharing and quantitative treatment limitations imposed on mental health and substance abuse services in a health plan are not more restrictive than medical and surgical services within the 6 classifications that are listed here on your slide. To assist with this requirement, the Department of Labor has issued a very useful self-compliance tool that I recommend that you use in order to determine your compliance with these mental health parity rules. The mental health parity rules also, and subsequent guidance also addressed non-quantitative treatment limits. So quantitative treatment limits, we have co-payments, we have treatment day visit limits. So if you go to receive a service, you might have a 10-day annual limit on that service. Those are quantitative limits. Mental health parity also addresses non-quantitative treatment limits that apply to mental health benefits, similarly as they do to quantitative treatment limits. And so importantly, those non-quantitative treatment limits cannot be, they have to be comparable when applied to mental health and substance abuse benefits as they are with medical surgical benefits. So what are non-quantitative treatment limits? Let's take a look at that on the next slide. Oh, the results are in for the poll. Right now we have, it will require, the top answer is these, as a result of these transparency laws, it will require more company-wide education and communication. I think it will drastically affect cost. Only 13% said that. And 25% said they're not sure, we're just speculating at this point. Yeah, you obviously need more information, need to get a better handle of how this impacts you. And especially it will depend on what kind of a plan you have, whether it's insured or self-insured. But thank you for participating in the poll. So let's take a look at some examples of some non-quantitative treatment limitations. Medical management standards limiting or excluding benefits based on medical necessity. That's a big one. That's very common in a lot of plans. Prior or ongoing authorization requirements, concurrent review standards, certain formulary designs as it relates to prescription drugs may act as a gatekeeper for certain mental health or substance abuse related prescription drugs. Standards for provider admission to participate in a network, plan methods of determining usual, customary, reasonable charges. These are all different ways in which a plan can limit costs, but at the same time, if they're done so in a way that impact mental health and substance abuse benefits more so than medical surgical benefits, that would be a problem under the mental health parity rules. So let's talk about what recently changed in mental health parity. The Appropriations Act that was signed late last year included an amendment to the mental health parity rules. And what it required is that health plans must be performing a comparative analysis of its non-quantitative treatment limits and documenting those results. And that started in February of this year, that requirement. So we're already within the compliance time period, which means that regulating agencies are well within their rights to request that information. So beginning February 2nd, 2021, health plans must be prepared to provide these analysis and all supporting documents to a reviewing agency. If the agencies detect noncompliance, they may direct the plan to submit a revised comparative analysis within 45 days. Additional guidance is expected to assist plan sponsors, but at this time, I would recommend trying to, in a good faith manner, meeting your obligations by utilizing that self-compliance tool and seeing where you're at from a quantitative and non-quantitative treatment limitation compliance standpoint as it relates to mental health parity. Moving on to the next slide. So looking at some compliance steps, despite the expectation of future guidance, plan sponsors need to begin performing that good faith analysis right now, because you might find yourself in a situation where a regulating authority is requesting it. So at this time, consider your plan's benefit design. Are there any treatment limitations, any barriers that impact mental health and substance abuse treatments and services? If so, definitely will want to discuss those with your administrator and run them through this compliance tool to make sure that they meet the compliance guidelines for mental health parity. Regarding non-compliance with the mental health parity rules, similar to the transparency rules, that is a $100 per person per day penalty that can be assessed in the event that a regulated body feels that it's necessary to assess penalties for non-compliance. All right. So after talking about Cobra subsidies, talking about transparency disclosures, and mental health parity compliance, we finally get into something, our last topic of the day, that could impact your health plan. And these are all optional changes. So no major requirements here. These are all optional changes, but they're all optional changes you may wish to consider for your cafeteria plan. So what are some of these changes? The 2021 Appropriations Act from last fall and last winter and subsequent IRS guidance allows a number of different changes for cafeteria plans. Number one is that plan participants can make prospective changes to their health FSA elections, their group health plan elections, and their dependent care FSA elections on a prospective basis without incurring a change of status event. So that's significant increased flexibility for plan participants. Additionally, a plan can decide to have unlimited carryovers of unused amounts from the 2020 plan year and or the 2021 plan year from the health and dependent flex accounts. If you don't have carryovers and instead you use grace periods, you have an extended grace period of up to 12 months for 2021 and or 2020 and or 2021 plan years to file claims for any unused amounts in those health and dependent care flex accounts. So remember, you can't have both. You can't have both a carryover and a grace period. You have to pick one or the other. If you do not have either one at this time, the rules do allow you to add this mid-year so that you're able to amend your plan to be able to provide for this benefit. Regarding dependent care benefits, there's an increased dollar limit on the amounts that can be reimbursed. Previously, it was $5,000 for joint filers. That's been increased to $10,500 for 2021. And then with regard to increased age limit for dependent care flex account, for 2020, for anyone who elected dependent care coverage during an open enrollment that was on or before January 31st, 2020, the age limit of the particular dependent was the max age was 13. So if someone would have turned 13 in 2020, they would be limited in what they can receive distributions from their dependent flexible spending account. Well, that age limit for 2020 was increased from 13 to 14, so that if someone turned 13 in 2020, they can still take advantage of the dependent care benefits. Additionally, if there's a balance remaining in the participant's dependent care flex account at the end of the 2020 plan year, the participant may use the balance for the child's expenses for 2021 until that child reaches age 14. Let's talk about some next steps as it relates to the cafeteria plan changes. Like I said, all these changes are optional for employers to adopt, The plan amendments are generally due at the end of the first calendar year after the end of the year in which the change is taking place. So for example, if you're changing the 2020 plan year, cafeteria plan year, you need to get an amendment in by December 31st, 2021. If it's for the 2021 plan year, then December 31st, 2022 is your amendment deadline. Also, the plan has to be operated in a consistent manner with the guidance. So if you're going to make the change now but amend later, you need to operate within the rules. You also have flexibility in customizing these changes. So even though someone could make a change prospectively, the employer has the ability to design those changes. So you can limit the amount of changes that can be made. You can only allow them, for example, to take advantage of a situation where they can increase or improve coverage rather than just dropping coverage. You can have a situation where you're only allowing a change that allows an employee to add dependents. The idea here is that these are optional changes and there's flexibility in how you implement them. Also remember the non-discrimination impact. Usually when you change dependent care benefits or you increase those benefits, that may have a tendency to cut in favor of highly compensated individuals, which may pose a problem from a discrimination testing standpoint. And then last but not least, remember that these are cafeteria plan changes and not changes to your actual group health plan document. So you need to remember to contact either your insurer, maybe your stop loss carrier if you're self-insured, and take a look at your governing plan documents. Those may need to be amended to accommodate the changes that you're making to your cafeteria plan. So that was a lot of information. If you have any questions, we'll do the best we can to address those. And then we have a poll question here, the last one, I believe. Where could you use more information? So let's go ahead and see where the answers lie there. Thank you for participating, and it's been an absolute pleasure to be able to walk you through some of these new changes for 2021.
Wes, really appreciate it. That was very well done, concise, informative, to the point. Fabulous job. Really, I appreciate you, and I appreciate Enrollment for giving us your time today. We loved it. As we wrap up the discussion, we just put a poll question. We're going to put up one more poll question as well, and we'll get into the reasoning why in a second. But some of the things regarding this discussion, we've recently, as an organization, fielded a lot of questions regarding the Cobra subsidy and transparency. So I think this is extremely timely. Please pay attention to some of the deadlines that have been set forth by legislation and some of the financial impacts that could be brought upon our organizations over the upcoming months. I'm really interested to see where a lot of these providers go from here, the carriers and our plans. And as an organization, we've been really actively working towards creating a lot more transparency with our clients and driving consumerism through employees. And so we think this is going to be a lot of these topics are going to have a big impact on cost moving forward over the next couple of years. We have that final poll question up, unrelated to what we just talked about, but we've also got a lot of questions recently over the Blue Cross and Blue Shield settlements. And in terms of upcoming topics, this is one of the items that we're going to be talking a lot about, the email, the webinar via web blast. So let us know where we can help here. If you have any further questions, please reach out to me, reach out to your Axion team, reach out to Wes. We'll make sure that this recording is sent to everybody, as well as Wes's direct contact information. And we're always looking to connect folks with really good partners like Wes and Enrollment. So Wes, again, thank you very much. We appreciate everybody's time today. Have an awesome Friday, and we'll connect soon. Take care.